So this is a nice young lady from the Midwest, 31 years of age, from out of state. So as you will see, 100% total capsulectomy, 22625 initials KA. Her first set of implants was 2011 saline, and then she opted to go into silicone implants 2020. So these are just 5-year-old set of implants. Now, as you will see, she had a grade 3 capsular contracture on the right side, very hard and firm. And as I dissected, as you will see, everything was dissected around very well. And as I was dissecting, this is the part where it was sitting on top of the chest against the rib. So everything went very well. As you can see, she's got a low BMI, very thin, athletic lady. And so as I was dissecting on the rib, this is the part that was on the chest. There was an inevitable break in the capsule because it was super tightly adherent to the rib. So as soon as this happens, sometimes I can suture it. In this case, I decided to plug it with a 4x4 ray tack. And as you will see, wherever this break is, I'm able to plug it and nothing spills out. So as you will see, look over here, you can see actually the cartilage part of the rib. Right here, this is the cartilage part of the rib. This is the cartilage that I'm grabbing right here. This is the cartilage part of the rib, and you can see the rib markings right here. So I had to put this in order to basically block any of this from falling out, and this was the very last part that I waited for. You can see again the rib right here, and so as I go in, what's very interesting about this case is it's just 5-year-old set of silicone implant. The gummy bear, the nicer, the better, the safer. And look how thin the capsule is, relatively speaking. And that we have a ruptured silicone implant, to my total 100% surprise. This nice lady even asked that if I could do like a Facebook Live for her. I told her no reason to, because I want to be able to teach it. And lo and behold, she has a ruptured silicone implant, to my total surprise, and I'm sure to her total surprise as well. I'm going to move this away, and you can see it's completely, you can see how thin it is. You can see the implant underneath. There's nothing cohesive or safe about this implant, and she did not, look how thin this is. If I put it on top of the tissue paper, you can read it. And the hardest part was right on top of the rib. All of that capsular tissue, inflamed tissue, was removed. All inflamed tissue was removed, and only good, healthy, viable tissue remains behind. And as you can see right here, this is that ruptured implant. Again, total surprise for me, and I'm sure total surprise for the patient. So I'm going to go ahead and look at this. None of this spilled into the chest. Look, it's completely disintegrated. It's been like this for some time, God knows what. What's interesting is, if you look at the Mentor advertisement, the Mentor literature, it tells you get an MRI at year 3, and then every 2 years onward for the life of the implant. So she should have at least gotten 2 MRIs by now. Not my words, not my opinion. This is from the manufacturer Mentor itself. So look at this. Who could have ever imagined? I told her, as a matter of fact, 99% chance it's not going to be ruptured. I told her, because these are just 5-year-old set of implants. But this tells you that the breast implants, anything is possible, and you never know, and that's why they need to be monitored via serial imaging. So now, look on her exam on the left side, she had a grade 4 capsular contracture, and this is the part, this was pushing against her nipple right here. You see this protuberance right here? This was pushing against her nipple, and you could see it literally poked the nipple out, and I was pushing it, and I knew this is again part of that capsular contracture that she had. Again, very, very, very thin capsule. You can actually see right underneath, and you see the way it's protruding out. Hopefully this is not going to be ruptured, and I can tell from having dissected this one out and the other one, it doesn't have the features. So as I dissect this out, a lot of inflammation noted around that I removed, as you can see right here. So as I go in, again, just 5-year-old set of implants below the muscle. Very tricky case. I want to just show you, look how thin this capsule is. No matter how thin, it must be removed and completely. So as I remove this, you can see there is some fluid in the back. If I go like this, look at, it's not ruptured, but it did the same thing, this ruptured one. So this is this leaching of the silicone that is going out into the periphery, causing the hurt and the harm. So this is your Mentor implant, 600 cc's, Mentor 600 cc's. Mentor 600 cc's, very large implant for the patient's chest width. And you can see right here, look how thin the capsular tissue is. So there you have it. The take-home message is this: if an end block cannot be done, 100% total capsulectomy certainly can be, even in a ruptured implant, which does not mandate the placement of drains. If any of the silicone spilled into the chest, the drains will become mandatory. Number two, if any of the capsule is left behind or the surgeon chooses to cauterize the capsule on top of the rib, that is incomplete and bad surgery. The drains would then be required. In this case, the entire implant capsule, all of that inflamed tissue was removed completely, sincerely, definitively, wholeheartedly, honestly. And that very last step where that, if these are my ribs, and if you can imagine, the glove is the capsule, it was super tightly, super glued to the rib. That inevitable break, I was able to cover it and prevent any of that silicone spilling into the chest. One has to always assume, the surgeon has to always assume that the implant is ruptured till proven otherwise, even in a 5-year-old set of implants, because you don't want to find out otherwise that now the silicone spills into the chest and it's a major catastrophe to manage. You cannot wash it out, it will embed within the soft tissue. Just like slime, no matter how much you wash it off, it will continue to persist within the soft tissue itself. So it's best to contain it, and this is why the end block or 100% total capsulectomy is key, and the surgeon's approach is key. So one has to always assume the implant's ruptured, all of that capsular tissue and inflamed tissue is removed, leaving behind good healthy tissue. This surgery takes time, as you can see. It's a very large implant, certainly took the time. And it needs to be done. Blood loss was minimal, less than 10 cc's on each side, given the size, and we're all very happy with how the surgery went. So the implant, I just want to show one thing. Look at this implant, how innocent it looks. This is how it was. This thing was like this not too long ago, and look, it ruptured, and eventually its fate is going to be a rupture or symptoms, whatnot else. This lady had almost all, maybe well over 80% of the symptoms on that questionnaire. So again, we will see how she's going to be relieved just by the sheer weight of the implant coming off of her chest, the inflammation coming off of her chest, the silicone toxicity, as you can imagine, that was all contained by the capsule coming off of her chest, and we'll see how she does clinically. Implants will be returned to the patient's. Capsules will be sent to pathology, rule out the BIA, LCL, CD30 analysis, rule out lymphoma, rule out malignancy, rule out any abnormal pathology. Cultures for aerobic, anaerobic, and fungal. And again, like I said, we will see most importantly how the patient bounces back to a normal state of good health minus these toxins. This is Dr. Khan, Executive Plastic Surgery.